Good day, everyone. This is Angela May Ilovino, your reporter from Group 4. So, for this video, this is the continuation of the topic under equine anatomy. I will discuss to you the pelvic organs, blood vessels, and nerves of the pelvic limbs. So, where the pelvic limbs, of course, is located. Um, Pelvic limbs is said to be the primary propulsory of the horse, and thus one might expect that the hip extensor to be relatively powerful. The pelvic limb stay apparatus is used by horse to support the weight of the caudal end of its body while using a minimal amount of muscular activity. So, for the organs that are located in the pelvic limbs, first, let's discuss the skeletal part of the pelvis where the organs are located. The horse's pelvis is divided into two parts by the pelvic bones or the oxcosae. Each hemipelvis is made up of three flat bones, the ilium, pubis, and ischium, which are fused together to form one. The ilium connects the sacrum via sacroiliac joint, a synovial and pivocartilaginous joint supported by ventral, dorsal, and lateral sacroiliac ligaments. The sacrum connects to the lumbar spine and the coccygeal or the tail vertebrae. The two parts come together at the pelvic floor through a cartilaginous junction known as the pelvic or pubic symphysis. This is made up of hyaline cartilage and fibrocartilage and eventually ossifies until it is bone and totally united by the age of 6 years. So here is the skeletal part in the pelvis of the horse. We have the tubersacral, sacral spines, tubercocci, ilium, pubis, ischium, tubericii, tubercocci, crest, ilium, tubersacral, acetabulum, obturator foramen, tubericii, and the ischial arc. So let's move on now to the organs that are located in the pelvis. By the way, this is an actual pelvic bone of horse. We have organs in both female and male in horse. In the female genital tract, we have the vulva, vagina, cervix, horn of uterus, vestibule, bladder, body of uterus, fallopian tube, and the ovary. The vulva, vagina, cervix, uterus, and oviducts and ovaries are all part of the female genital system. The oviducts are tiny tubes that link the ovaries with the uterus. The cervix is the end of the uterus. It separates the uterus from the vagina and acts as an infection barrier. The vulva is related to the vagina, a muscular tube that runs from the cervix to the outside skin surrounding the opening of the vagina. The vulva is female genital exterior orifice. The oviducts transfer eggs to the uterus after ovulation. The oviducts secrete protein-rich fluid, which creates a suitable environment for the survival of the mature egg. Fertilization and the first few vital days of the embryonic development. The uterus and cervix must also operate properly in order for a pregnancy to be established and maintained, because they interfere with the healthy function of the uterus. Infections obtained during mating are typically causes of female infertility. Female infertility can be diagnosed using a variety of methods, including physical examination, ultrasonography, hormone testing, uterine culture, and uterine lining biopsy. The vagina and vulva are copulatory organs and the last section of the birth canal. Mares with impaired vulva and vaginal function may be prone to repeated contamination of the reproductive system, leading to persistent uterine infection and infertility. So those are the organs in the pelvic limbs of the female horse. Let's move on to the male organs of horse. The genital tract in males serve as an conduit for sperm cell and semen. The testicles are responsible for the production of sperm and testosterone, the main male hormone. Sperm travels from the testicle to the epididymis, where it matures and is stored. The epididymis joins the ductus deferens, which transports sperm to the urethra. The fluid part of semen is produced by accessory sex glands such as the prostate and seminal vesicles. Physical examination or ultrasonography can be used to identify genital tract abnormality. A sperm examination can offer information about the quality and quantity of sperm as well as an estimate of fertility. So these are the organs that are in the pelvic limbs of horse. We have the prostate gland, vesicular gland, bladder, vas deferens, urethra, glans penis, scrotum, testicle, and epididymis. So let's move on now to the nerves to the pelvic limb. So caudal, cutaneous, femoral, and are located in this section. The lateral cutaneous femoral end is here. The peroneal nerve is here, and so on. So femoral nerve, or L4, L5, sometimes L3, L6. The formula for the femoral nerve in the pelvic limb of horse. Femoral nerve again is the largest nerve of the lumbar plexus. Its role in the motor and sensory processing in the lower limbs. It controls the major hip flexor muscles as well as knee extension muscles. Its muscle innervation, stifle extensor quadricep iliopsoas. Its cutaneous innervation is is the medial aspect of limb. The obturator nerve, or L5, L6, arise from the lumbar plexus and provides sensory and motor innervation to the thigh. This nerve provides motor innervation to the medial compartment of the thigh, and as a result, it is essential to the adduction of the thigh. Then the gluteal nerve, found in the lower pelvis, muscle innervation, gluteals, TFL, biceps femoris, semitendinusus. The cutaneous innervation, nail, and the sciatic nerve, which runs from the lower back to the hind legs, may be injured by hip fracture or during surgery to connect a broken leg. Then the tibial nerve, um, which divides into plantar nerves just proximal to the point of the hook, which provide the superficial and deep sensitivity of the main part of the tarsus, metatarsus, and distal limb. Next, the muscle innervation is extensor of hook, flexor of digits. Its cutaneous innervation, the caudal aspect of the limb below stifle. And lastly, the fibular nerve. Um, fibular nerve is said to be the lower leg that provides sensation over the posterolateral part of the leg and the um, the joint. Muscle innervation, flexor of hock, extensor of the digit, cutaneous innervation, cranial and lateral aspect of limb. So this is the nerves of the equine pelvic limb. We have the lumbroscal plexus, which is divided into two. We have the femoral and sciatic nerve. Out into three. I mean the obturator nerve. Femoral, we have the saphenous nerve, and sciatic nerve is divided into two. We have the comparanous nerve and the tibial nerve, and so on. Next is in the medial side of the thigh. The side of the thigh and the grip. So the innervation of the muscle in this region comes from the cranial and caudal gluteal and the sciatic and the tibial nerves. The cranial gluteal nerve supplies the sensor fasciae latae and the gluteal cutaneous profundus, accessorius, medius, and superficialis. These muscles arise variously from the causal tuber, the gluteal surface of the ilium, and from the gluteal fascia. The gluteus accessory is considered to be a deep part of the gluteus medius. The gluteus superficialis is partly fused with the tensor fasciae latae. Both arise from the um, coxal tuber, but also from the gluteal fascia. The caudal gluteal nerve supplies the vertebral heads of the bicep, semitendinous and semimembranous. Their ischial heads are served by the tibial nerve. Um, um, the sciatic nerve leaves the pelvic cavity by greater sciatic foramen and passes medial to the greater trochanter around the caudal aspect of the hip joint. Here, it releases branch to the group of insignificant hip rotator, gemini, and obturator, quadratus femoris, and the extensor obturator, which, however, is innervated by the obturator nerve. It is possible already at the level hip joint to separate the sciatic nerve into tibial and common peroneal nerves. The tibial nerve sends proximal muscular branch to the ischial heads of the hamstring muscle and in mid-thigh gives off the caudal cutaneous sural nerve, which accompanies the lateral saphenous vein along the common calcanean tendon and ends on the lateral surface of the tarsus. The hamstring muscle arise with their ischiatic head from the ischial tuber. The bicep ends laterally on patella, lateral patellar ligament, crural fascia, and with its tarsal tendon on the calcanean tuber. The other two hamstrings ends on the medial aspect of the limb, semitendinous on the tibia with its tarsal tendon also in the calcanean tuber. The semimembranous with two insertion tendon on medial caudal of femur and tibia. In leg, cross opposite nerve gives off distal muscular branch to the extensor of the hook and flexors of the digit described in the next paragraph. The nerve then descends between the two heads of the gastrocnemius and gastrocnemius and along the medial surface of the common calcanean tendon to give rise before reaching the hook to lateral and medial plantar nerves. The common peroneal nerve crosses the lateral head of the gas gastrocnemius where it releases the lateral cutaneous sural nerve. The latter emerges distally between the middle and the caudal division of the biceps, distal to the stifle. The common peroneal nerve splits into the superficial and deep peroneal nerves which innervate the flexors of the hook and the extensor of the digit. The two nerves then descends between the lateral and long digital extensor to the dorsal and lateral surface of the metatarsus. The entirely tendinous perennius perennius tertius divides into the dorsal surface of the hack, joined into four terminal branch at the origin of which is also forms as a ring-like tunnel for the passage of the tibialis cranialis. It terminates with wide medial and dorsal branches on MT3, TC, and the T3, and with superficial and deep lateral branches on the calcaneus and T4. The tendon of the tibialis cranialis, after emerging from the peroneus tunnel, split to insert with a dorsal branch of the MT3 and a medial branch on T1 and T2. The long digital extensor, guided by the three extensor retinacula, passes the hook dorsally and ends on the distal phalanx, with secondary attachments also on the other phalanges. The lateral digital extensor ends by joining the tendon of the long extensor below the hook. The insignificant M extensor brevis needs no further. So these are the so let's move on now to the last section of our topic, the blood vessels. So, blood supply to and return from the pelvic limb flows predominantly through the external iliac vessels. Though the internal iliac vessels are also involved, the internal iliac vessels release the cranial and caudal gluteal vessels to the crop and thigh. The cranial gluteal artery gives off the obturator artery, while the satellite obturator vein is a branch of external iliac vein. As the external iliac vessels enter the thigh by passing caudal to the inguinal ligament, they become the femoral vessels. These at once give rise to the deep femoral vessels, which in turn release the pudendub-bigastric trunk. As the femoral vessels traverse the femoral triangle, they give off the lateral circumflex femoral vessels that enters the quadricep between rectus femoris and vastus regalis, and the saphenous vessels, of which the vein is very much larger than the artery. This accompany the like-named nerve and in proximal third of the leg divided into cranial and caudal branches. The cranial branch of the vein passes the tarsus dorsomediale to become the dorsal common digital vein 2 in the metatarsus. This crosses the large metatarsal bone obliquely and unites with the medial plantar vein. The caudal branch of the medial saphenous vein and artery pass distally in the groove cranial to the common calcanean tendon. The vein anastomus proximal to the hook with the caudal tibial vein and with the lateral saphenous vein, and passes the hook plantaromedially, where it divides into medial and lateral plantar veins. The saphenous artery anastomosis with the caudal tibial artery give rise to the medial and lateral plantar arteries. In distal third of the thigh, the femoral vessels releases the descending artery and the vein of the stifle and other vessels to that joint. Some of the latter arise from the popliteal vein vessels that continue the femoral vessels at this level. The last branch of the femoral artery and the vein are the caudal femoral vessels. The large caudal femoral vein releases the lateral saphenous vein, which follows the caudal border of the gastrocnemius distally to the anastomus proximal to the hook, with the caudal branch of the medial saphenous vein and with the caudal tibial vein. Opposite the head of fibula, the popliteal veins bifurcate to give rise to the cranial and the smaller caudal tibial vessels. The caudal tibial vessels descends caudal to the tibia. The cranial tibia vessels, however, pass cranially between tibia and fibula, follow the tibia craniolaterally, and the hook become the short dorsal pedal vessels. The continuation of the pedal artery, the dorsal metatarsal artery, is the largest artery in the metatarsus. It passes over the lateral surface of the cannon bone, then between this bone and the distal end of the lateral splenic bone to the plantar surface, where it receives the thin plantar metatarsal arteries that descends on the plantar aspect of the metatarsal bones. So, these are the nerves where the nerves and veins, arteries where the blood flow in the pelvic limb. Again, from the first discussion, we have the skeletal part of the pelvis, then the organs of the female and male genital tract, then the nerves of the pelvic limbs, and the blood vessels where veins and arteries, nerves, blood flow.